Okay, so I'm trying to think of how to start off talking about this. I did a brief introduction of, on my last video, of sinus, of tachycardias being fast, normal rhythms being normal, and your slow rhythms are your bradycardias. And I guess the way that I was studying it, this ghetto. I don't smoke. But the way I was studying it, they started with the sinus rhythms first. So I guess we'll start there. So, like I said, the sinus is the top part of the heart. That's your atrium. Those are the part that kind of do the receiving of the blood. They're like the catcher. They're like, gotcha. Um, the right side has the deoxygenated blood, is catching from the superior vena cava and inferior vena cavas. And then your left side is catching from your lungs, from your pulmonary veins, and they're both shooting them. Both of your atrium are shooting into your ventricles. So the node that you have up there that's electrical is your sinoatrial node. That was always easy for me to remember where it was because it has atria in it. So that's what makes it easy for you to know, okay, this is not the one that's kind of near the ventricles. This is the one directly on top with the atrium because it's the sinoatrial node. Now, let's talk about some of the rhythm issues that you could have up there. Of course, you have your normal sinus, which is going to start in your SA node, your sinoatrial node. It's going to go to your atrioventricular node, and then it's going to go to your Purkinje fibers and a bundle of his, right? Or is it the bundle of his? It's a bundle of his and Purkinje fibers, because the fibers are the teeniest ones. That's your normal pattern. Now, when you go to put in your EKG, this is like really important, and I learned it in school, and I don't see that anybody's teaching anybody. When you put on EKGs, what I learned, I think some people said white is right. No pun intended. But what I do know that they told me is that smoke goes on over fire. So you always want to make sure that your fire is going to be on that person's left side. So when you're looking at them, you're kind of reaching across over to your body. Boom. You're putting on that red on the bottom area of their chest, and then you're putting that white on top. No, sorry, not white. Black. Smoke goes over fire. For the brilliant people out there like me. And then your white is obviously going to go across. Now there's a lot of other colors that they're going to throw in there. At one point in time, I had the EKG memorized by color. So then you have your white on the right. I'm confusing myself. You're on your left side. You have your red on the bottom. You have your black on the top. You're going to put your white on the other side. Now, what some people like to do is the lead that goes right underneath that side. That's going to be the patient's right side. So white is right. It's going to be green. So I guess that's kind of like, because the opposite of red is green. Like Christmas, red, green, black, white. So just remember smoke over fire, and that's how it'll help you. Some people put it on their shoulders. I always actually tend to put it here, but I've seen some people put it here. I've seen it put a lot of places. It's actually, some doctors will really freak out where you put it. Now, one of the things that I've noticed that they're really getting strict on is the placement of your EKGs. So you want to remember mid-axillary is going to be in the middle. Right, this line is going to cut your whole body in half. Mid-axillary, axillary, mid-axillary. And then your mid-clavicular line in the middle of your clavicles. That's why they name these things. I didn't know that. Your mid-clavicular line. So what's important for you to remember is that the EKG is going to go on your fourth. It's going to start on the fourth intercostal space and then go down to the fifth. The important way, the intercostal, there's no really way to remember that word. That's an ugly word. It's the in-between space when you're looking at the person's chest on the ribs. So it's easy. You kind of just press. You start, you know their clavicle's here, so you know you're going to find a lump of space here. That lump is going to be in between the clavicle and that first rib. And then you just count with your fingers. Usually your finger width is about the width of the intercostal space. So once you slid down like that, you can just 1, and then I just put 1 finger down and mark it, 2. Sometimes you could just ball it, 3, 4. You got to make sure that you count down to the 4th intercostal space, and then you put you're going to have, I'm looking at myself on this thing, so I'm going to try and think of how I would do it if I was the patient. So don't think of what I'm doing. Watch what I'm doing on the screen, because I think it's going to be right. So here is where your V1 is going to go. So you got your arm and leg. Those are easy to determine because you know where your arms and your legs are. So it's going to say right arm. Go ahead and get it. It's going to say right arm, right leg, left arm, left leg. You're going to put those arms on just like it says. And then you're going to take your brown lead, and the brown lead is going to go right. I usually start, you count down to your 4th intercostal space. Boom. Then you jump on the other side of your sternum, and you drop another lead. I usually do it right on the outside. You want it to kind of be right on the outside of the sternum. Then I know my 3rd EKG lead is going to be here on the mid-clavicular line. So you want to drop that down 5 spaces. Now, for those of you with perky, lovely boobs, it's going to go underneath your nipple. If you've got boobs down to your stomach, don't put the lead underneath the boob just because you don't want to embarrass the lady. You know, you got to deal with we're dealing with where the heart is, and the heart is not going to always relate to the boob. I breastfed 2 kids, so even mine are a little low. So it's up to the doctor, of course. You want to ask the doctor, but I say put them right on that 4th and 5th intercostal space, even if that's on top of the boob. Because some people got low boobs. Anyways, so you drop that there. Then that's your 3rd. You remember that intercostal space is your V3. So you still got to drop your 2, 4, 5, and 6. So the 2 I put here. So you got 2, then you got 3, then you got 4, 5, and 6. You can figure that out. This ain't your job. I ain't getting paid. So 4, 5, and 6 over on this side. If you think, once you do that EKG, if you think that somebody's having an inferior heart attack, or I think a right side heart attack, you can flip it, boom. It's here, sorry. You can flip it, boom, and then you can drop those leads, V1, 2, 3, 4, 5, 6. You can just reverse them and put them on the other side. Some people even do it on the back. Depends on what the physician wants. Just know that each of these leads are looking at your heart from a different direction. So like my V3 is going to be looking straight on at the heart. My V2 is going to have a little bit of an angle. It's going to have a little bit of an angle that it's looking at. The 6 is going to be looking directly from the side. So what they're measuring is which way the electrical conduction is going. My daughter. Let me see if I can find that thing that I wrote for you. You know, Mark Twain said a measure of a person's intelligence is not how many facts they can remember, but how much they can create in their mind. And they found that his frontal lobe, which is like this, the front, which is the part responsible, I guess, for like math and how intelligent you are, was like really, really large. And they think it was from all of these things where he would just sit at home and he would just imagine, you know, what would it look like? What would outer space look like if I was just traveling 1,000,000 miles a minute on a comet? But that supposedly made him really smart. And I feel like that's actually really useful when you're thinking of EKGs. You think of, we'll have to do this in a second. So get on my next video and then we'll talk about this.